Hi guys, Dr. Qureshi here, and today I will be talking about certain conditions related to contact lenses. As you all know, I see patients who are wearing contact lenses, who come in for eye diseases, they come in for glaucoma, and they come in for diabetic retinopathy, hypertensive retinopathy, they come in for glaucoma, pediatric conditions, geriatric conditions, like it's a full range of diseases and pathologies that they present to it. But there is a major portion of patients who are wearing contact lenses and they come in with some conditions or pathologies related to either poorly fitted contact lenses, sleeping in contact lenses, wrong use of solution, or overwear of contact lenses for that matter. So today's video is going to be focused on everything related to contact lenses. And I know there is another video series on my playlist as well as in the courses section on YouTube channel where I have discussed with my patients in the exam room about what can potentially go wrong if you are not using the right kind of solution, or if you're overwearing your contact lenses, those kind of things, or if you end up having infections related to contact lenses or even an abrasion. Or if your contact lens gets stuck in your eye, maybe I should make a video on that as well, because I do get patients who come in with a contact lens that's just stuck in their eye, and they just have that foreign body sensation. They do not know what's going on. They just start putting their fingers in their eyes and start to, navigate it themselves, and then they end up having a worse infection or an abrasion, or they get worse red eyes also, and definitely a lot of pain. So if the contact lens is stuck in your eye, remember, don't try to, if it's obviously visible to the naked eye, then yes, take it out. But if it's broken, or you feel like it's gone under the lid and there's no way you can take it out, because it's a contact lens, it's a very, very thin, flimsy material. So if you feel like you cannot take it out yourself, you've tried it, you've put the normal saline solution in your eyes and still not coming out, definitely come to your doctor, come to your eye doctor, okay? So because we can see it behind the slit lamp and it's very easy to take it out that way. I've had cases where a patient had worn 2 contact lenses in her eyes and she did not know that there were 2 sitting in her eyes, one on top of the other, because she forgot to take it out at nighttime. So she ended up wearing another contact lens over her eye, and her vision was really blurry, and she didn't understand why was her vision blurry. So she started saying, "Oh my God, my eyes are going blind," or "Oh my goodness, I have worn the wrong contact lens." But it wasn't. She was wearing 2 contact lenses. There have been patients, I'm not even kidding about this or exaggerating, but they have had multiple contact lenses in their eyes, like 3. I remember there was one patient with 3 contact lenses in their eyes because they just forgot to take it out. So I do not know why they do not feel like something is wrong or abnormal going on in their eyes, but probably they just get so used to it that at the end of the day, they do not understand. They know that there's something wrong, but they do not understand the root cause of the problem. So that's something related to contact lenses. There you go. So that was a good start, I guess. So now the second thing that I'm going to talk about is contact lens papillary conjunctivitis, which is also known as giant papillary conjunctivitis, or GPC. This is what the picture looks like when we invert the lid, which means turn it. We see a lot of big bumps. So that's why it's called giant papillary conjunctivitis, because these papillae really are gigantic behind the slit lamp. So when I'm examining the patients, I notice these big bumps, and I always tell the patients, please stop over wearing your contact lenses, or please stop sleeping in your contact lenses, because these bumps are not going to go away on their own. There's a way to improve this condition, because we have to tell the patients, decrease your contact lens wear time. Sometimes I even tell them to switch to a daily lens instead of a monthly lens, because the condition tends to get a little bit better when they just put in the lens and then throw it away, versus keeping the same lens for extensive period of time and then reusing it, which means it's a monthly lens. So that's one thing that I tell my patients when I see giant papillary conjunctivitis. These look like big bumps, like I said, and it can bother them also, because every time they blink, they're going to feel the bumps rubbing against the cornea surface area. So yes, definitely take out your contact lenses, don't sleep in them. Then we have another condition, which is, I'm going to see a picture, if I can find a picture for you guys, because I know you guys like pictures. So this one is known as corneal neovascularization, and this one is something that I have discussed with a lot of my patients. So you see in the top it says corneal neovascularization. This is a condition where on the cornea you see blood vessel growth. So I'm going to grab my pen here to show you what I mean by that. So you look at the cornea. Obviously by now everyone knows what a cornea is. So this is the cornea, the transparent part where the lens is supposed to sit. These are blood vessel growth on the cornea. This is a bad sign, okay guys? When I see blood vessel growth on the cornea, it's a bad sign. And I can see these behind the slit lamp. These are all obviously slit, like this picture, this one. These are all slit lamp pictures. But this corneal neovascularization happens because, again, patients are over-wearing their contact lenses. There is okay, so let's talk about the anatomy of the cornea. The cornea is an avascular structure, which means that it does not have its own blood supply. So when you wear a contact lens, obviously that oxygen transmission is depleted a little bit because the cornea gets its oxygen from the atmosphere. When you put a contact lens on your eyes and then you start sleeping in them, obviously that oxygen transport is depleted a little bit. There is some oxygen that they can get from the aqueous, which is the fluid in the eyes in the anterior chamber, but that's not enough. So during the daytime, obviously our cornea is getting its oxygen supply from the atmosphere. Now you put a contact lens on top of that cornea and you're depleting that oxygen supply to it. Now there are lenses obviously that cause the permeability of oxygen, which means that the oxygen can permeate through their cornea, through their contact lens into the cornea. But if you are over wearing your contact lens, so that's like something that everyone should understand. If you're over wearing your contact lenses, then the oxygen supply gets depleted and the oxygen is carried in the blood. So blood vessels start growing on the cornea in order to provide the cornea some oxygen. So that means the cornea is dying. In other words, in a very simpler way, I wanted to say that. So the cornea is dying, the cornea is asking for help, the blood vessels start growing on it, which is known as corneal neovascularization. Neo means new, vascularization means blood vessels. So the new blood vessels would start growing on the cornea in order to prevent the cornea from having no oxygen. So this is another picture where you can see this is what the corneal neovascularization is all about. So this is not normally I see a lot of blood vessels growing in the peripheral part and then they can encroach onto the central part also. This is how the corneal neovascularization starts. And again, it's a very bad sign and I tell my patients right away, hey guys, you're sleeping in your contact lenses or you're over wearing them. So either switch it to a daily lens. I personally love daily lenses for my patients. Daily lenses, which means, or one-day lens, which means it's the highest performance lens. There's less chances for contamination, less chances for abrasion, and patients know that, hey, listen, it's a one-day lens. I just put it in and then I throw it away. So it's not like they're going to forget and sleep in it and then or wear another lens on top of it. So those are the things to keep in the back of your mind. A one-day lens is definitely the highest performance lens. And in certain parts of the world, for instance, I think I read somewhere like in China, maybe in Japan, because there's a lot of pollution there, they do not even give them monthly lenses. They just give them one-day lens. They don't even recommend 2-day or 2 weekly lenses. They just have a one-day lens. And I do 100% agree with that concept because something that you wear and then throw away is definitely going to be better for your general eye health also. So those are the two conditions that we talked about. And then there was another one. I'm looking through the book just to see if there's something that would be interesting for you guys or something that I do see in my clinics. This one is a nice one also. It's called, you can see the eyes look pretty red. So it's contact lens acute red eye, which is also known as CLAIR. So again, contact lens acute red eye, as you can see, it looks pretty red. This condition happens from poorly fitted contact lens. So you can see in this picture again, the area where the contact lens is supposed to sit, it was very tight fitted contact lens and therefore this person developed redness. So this looks very classic in patients who have the wrong base curve or diameter, because if you look at your contact lenses, you're going to see there will be like numbers on them. There will be 8.4, 8.6, and then there'll be a diameter. So just remember those numbers mean something. So that means that either the contact lens is sitting flat or it's steep. We don't want a flat lens, we don't want a steep lens, we want the perfect fitted lens. So if, for instance, if a doctor notices, oh my God, that lens is not moving well on the cornea, stuck very tightly onto the cornea, it can potentially lead to this condition which is known as contact lens acute red eye. So then we have to change the fit of the lens and make it less flat. Or if you look at a lens that is pretty steep, then you have to make it less steep. So those are the things that your doctor can decide for you after evaluating the condition. But just in general, remember to take out your contact lenses. If you can do a one-day lens, then I highly recommend that, and use the right kind of solution. Now, talking about solutions, so different brands have different solutions that they recommend. For instance, Bausch & Lomb. So if you look at the BioTrue that is made by Bausch & Lomb, that does go in conjunction with some of their contact lenses. So if there is a Bausch & Lomb contact lens that a patient is wearing, then yes, combine that with the Bausch & Lomb BioTrue contact lens solution. Because what happens is sometimes the material that is made by Bausch & Lomb for their contact lens can become defected because of use of an other brand's multi-purpose solution, if that makes sense. So if it's a Bausch & Lomb contact lens, do that lens or rinse that lens or clean that lens with a BioTrue, which is a multi-purpose solution which is made by Bausch & Lomb. I'm not saying that the other solutions are bad, but I'm just saying that if one particular brand is recommending, hey, use our brand for our use our brand of multi-purpose solution for our brand of contact lenses, then there's a reason behind that. Because I remember there was a drug rep who came to my clinic the other day, and she explained to me the whole purpose of why their particular contact lens does go in conjunction with the multi-purpose solution that they have designed for that. So remember that. And then obviously, if you put the solution in the case for the contact lens, and then you take out the lens or contact lens from the case, you rinse it, you clean it, and then you wear the lens, right? And then afterwards, at the end of the day, when you're putting the lens in that case again, remember that solution needs to go away, right? You have to throw it away, and then you have to put new solution. I also don't recommend using tap water to clean your contact lens case with. You can clean it or rinse it with the multi-purpose solution, because that's more it's more hygienic. It's better for your general eyes and for your contact lenses storage also. So those are some things to remember. And then 10 to 12 hours of contact lens wear time is what I almost always recommend. So you put the contact lens in the morning, you go to work, and then, or you go to school, and then you come home. So after you come home, take it out, let your eyes breathe. Wear your backup pair of glasses so that your eyes get used to the fact that, hey, listen, now I have to take out the contact lens, and now I want my eyes to get the oxygen from the atmosphere. And that way, if you develop that habit, if you get really disciplined, guess what's going to happen? You're not going to sleep in your contact lenses, because you will discipline yourself. You will develop that habit of taking out your contact lenses. As soon as you come home from work or school, wear your backup pair of glasses, watch TV, go have your dinner, whatever you want to do, and then you go to bed. So when you go to bed, obviously, you don't have the contact lens in your eyes. So it's just a matter of developing good habits. And then I'm trying to think if there's anything else that my patients have asked me to discuss in contact lens related video. But those are some of the things that I just remember in the back of my mind. And also one more thing is the colored contact lenses. Patients sometimes come and ask me for colored contact lenses, and colored contact lenses are okay if they are being used for cosmetic purposes, like, you know, if you're going to a party, to an event, and you want to wear colored contact lenses. But according to literature, it's not recommended to you wear them or use them every single day. So what happens is, because of the way or the material that is used for the colored contact lenses, you're not getting enough oxygen transmission to the cornea. So that's why it's not recommended to wear them or use them on a daily basis. But there are certain brands that are not even making astigmatism contact lenses for colored contact lenses category. So sometimes patients come and they're asking for colored contact lenses with high astigmatism, and we don't have them. We don't even have those samples or trials to give them in the clinic. So remember that we're not trying to be hard on them. It's just that we don't have those trials. The companies are not making colored contact. A lot of the companies are not making colored contact lenses with astigmatism. And I don't blame them, because those lenses are not very good for the eyes. So those were some of the important things to remember. You can also have contact lens related ulcers, and those ulcers would happen more in the peripheral part of the cornea. I have seen those happening also, but it could happen in any part. But I've seen a lot of ulcers in the peripheral part related to contact lens because of poorly fitted contact lenses. And so that was all about contact lenses related eye conditions. Remember to take out your contact lenses at nighttime, clean it, rinse it, wash your hands. Do not have long nails when you're using contact lenses in your eyes, because you can potentially scratch your cornea. And also for eye makeup, if you are allergic to certain brands and you're wearing contact lenses and then you feel like your lenses are getting irritated, just take care of the makeup first, and then put in the contact lens. Okay, so that's all about contact lenses, and you guys have a wonderful rest of the day. You take care. Bye-bye.